I was going to go into pediatric dentistry. I had the grades, I had the board scores, I had everything. But and I'm not trying to be mean, but when I was taught pediatric dentistry at the state school I went to, it was very surprising and eye-opening to me that this is how we do dentistry for children. So I've taken a lot of traditional dentistry and taken it out of my treating of children and added my holistic dentistry. So my holistic dentistry, what are some traditional dentistry things that I was taught in dental school that I do not do now? Hold down a child. We don't ever hold down a child. We will make psychological problems and make that child an adult that doesn't go to the dentist. And everyone needs to go to the dentist to have care. Another thing is parents in the room. The only thing the child knows is their parents. They're not to be alone with the dentist without the parents in the room. All of my operatories, that's a fancy name for our dental chairs, have chairs. I have families of 5 and 10. I have sister sitting on the end of the chair while brother is getting his filling done. That is fine. The whole family and the comfort level of my patient in the chair is important. And if their family being there is part of that, that's fine. Traditionally in dentistry, we were taught when you take a child to do the treatment on a child, you never want the parent in there because they're going to mess it up, ask a bunch of questions, make the patient more anxiety driven. I found that that is false. The only person in the room that is in charge is you. And if you're in charge, then things will not go badly. I've had parents say some really crazy things, and I say, Mom and Dad, we may not say that. This is my patient. We're not going to be scared. It's not going to hurt. I'm going to talk about the treatment I'm doing. You're going to stand there and be supportive and tell Johnny he's doing a great job. And they get it totally. I said, otherwise you're going to have to leave because you're going to make my patient nervous, and I don't want my patient nervous. And, and they fall right into line. They know I'm an expert. They know I know what's best for their child. So that and alone, holding down patients and not allowing parents to come back with their own children to have treatment are two things I said, okay, when I get out of here, we're doing it differently. There are some holistic things I do differently for children. For instance, a root canal for a baby tooth is done differently than a root canal for a grown-up tooth. But oddly, a root canal for a baby tooth it uses former creosol, which is, I think, of an extreme toxicity and should not be placed in anybody's mouth. For instance, when I learned dentistry and was taught to do baby root canals on baby teeth, the former creosol I poured out and it would eat through the cup that I poured it into. If it can burn a hole through the cup, then I don't want to put it in somebody's mouth. And so there are some materials that we use today to fix the nerve, is how they put it, to kill the nerve, to make the nerve not alive so it won't infect the body and won't get inflamed. I will not put those in somebody's mouth. There are other ways to treat teeth that need root canals for baby teeth. Another thing, fluoride. Some people want children to have fluoride. Some people don't. Holistically, I think children swallow a lot of the fluoride we put in their mouths. So it's for your teeth, not your belly. We do not use fluoride on children if they're going to swallow it. Mercury fillings. The easiest filling to do in the mouth with the materials that we have is a mercury filling. It's an amalgam filling. It's the fancy name. It can get wet. And guess what kids do? They move around and they lick all the time. And so, wow, we could do a filling and we wouldn't have to worry about it being dry. Let's use mercury. We're putting a component, mercury, in a child's mouth when they're developing that is full of toxicity. I will not do that. And I was taught that in dental school when I was. So those are things I've given up and changed.